Cardiac syndrome X, more recently termed microvascular angina, causes chest pain symptoms, and in this video we look at the physiology of the condition and what exercise program would be suitable if you suffer with it. Hi everyone and welcome to Exercise for Health. I'm Richard and today I'm going to provide exercise advice for people that have been diagnosed with microvascular angina. If you're new to this channel, we offer tips, advice and exercises to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Microvascular angina presents symptoms that mimic coronary heart disease. However, the physiology is very different. Initially, it was given the term cardiac syndrome X because little was understood as to why people experienced chest pain when they had no obvious signs of plaque buildup in their coronary arteries that supply blood to the heart muscle. However, more modern investigative techniques such as cardiac catheterization with coronary flow reserve can now diagnose the condition, and the symptoms of the chest pain are actually caused by damage or malfunction of the small vessels invisible to the human eye that supply blood to the heart. So although there is no heart disease present, the damage causes spasms that disrupt the oxygenated blood flow to the heart muscle, producing the same angina symptoms of chest pain or tightness, nausea, lightheadedness, shortness of breath and fatigue. It's important that at this point to note that if you haven't been diagnosed with this condition and you have chest pain that doesn't go away or gets worse, you should seek emergency medical attention, as this can also be a symptom of a heart attack, which is obviously much more serious. Microvascular angina, however, affects women far more than men at a ratio of about 9:1, and it is more common to be diagnosed during the menopause, but certain lifestyle factors such as obesity, smoking, high blood pressure, raised cholesterol, lack of exercise, diabetes, and a poor diet that is high in salt, saturated fat or processed foods can also increase the risk of the condition as it does with coronary heart disease. Interestingly though, chest pain can be experienced at any time and may increase with mental stress, but less often with physical exertion as with normal angina. And although many people may be given medications to manage the symptoms, such as any of those shown on screen now, exercise is highly recommended to help prevent further damage to the small vessels. As this condition still raises your risk of a heart attack, as it restricts blood flow to the heart muscle, then the exercise prescription will be similar to that of someone who suffers with coronary heart disease. This means that we would conduct a lengthy warm-up of about 10 to 15 minutes, slowly building the intensity to gradually raise your heart rate whilst monitoring symptoms of increased chest pain or excessive breathlessness. The main component of your workout, which would last for about 20 to 30 minutes, would comprise of a circuit of both cardiovascular exercises. These are those that predominantly work the legs, such as walking, cycling, step-ups, squatting, lunging, or even using a cross-trainer machine for a short time frame of around 2 minutes each. And active recovery exercises using the arms, such as press-ups, inverted pull-ups, side raises, front raises, bicep curls, or tricep extensions, with a moderate weight so that you can manage 10 to 15 repetitions, keeping the feet moving where possible. After conducting this main circuit in an interval format, switching between cardio and active recovery exercises, you would then finish with a lengthy cool down, slowly reducing the intensity for about 10 to 15 minutes to bring your heart rate back down, again monitoring for any increased chest pain before finishing with some relaxed stretching and breathing at the end. You should always use the rate of perceived exertion scale during your exercise program to help you monitor your intensity, especially if you're on a beta blocker medication, ensuring that during the main component of the workout, you stay within a 4, 5 or 6 on this 1 to 10 scale. This level of intensity will help you gain the benefits of the exercise whilst reducing the risks of any complications in the heart. If at any point you do experience any severe chest pain that is unexpected, then you should stop immediately and seek medical attention. So I'll put up on screen an example program one might do in a gym setting or at home, but there may be a cardiac rehabilitation program offered near you that's worth looking into joining so that you can gain individual advice and expertise in a supervised class to give you that extra confidence to exercise. I've also done a cardiac rehab workout video on this channel that you can follow at home, and I'll leave a link to that one on screen at the end of this video. I hope this has provided you with some useful information today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.